back to winning isn't easy. So what are the 21 things that your doctor should address in your medical records in your ERISA disability claim for dizziness? Once again, ERISA disability carriers or plans often deny claims for dizziness because of the lack of an objective basis for the diagnosis. After all, anybody can claim that they're disabled because of dizziness. And in the view of disability carriers or plans, subjective complaints are easy to dismiss. There is no gold standard test to prove that you have dizziness. What they want to understand is the cause or source of your dizziness. It can be related to a number of diseases such as Meniere's disease, neurological disorders, tumors, metabolic disorders, vestibular dysfunction, even the side effects of medication. So when you're filing an ERISA disability claim for dizziness, I assure you that the disability carrier plan is going to have your medical records reviewed. And you need to understand what it is they're looking for so that you make sure your medical records are accurate and complete. So what are those? Well, what is the diagnosis of your dizziness related to? What's the average frequency of your dizziness episodes per week and per month? How long does an episode last? Do you have any warning of impending dizziness attacks? How long is it between the warning and the episodes of dizziness? Can you take safety precautions when you feel an episode is coming on? Are there precipitating factors such as stress or exertion? What are the symptoms associated with the dizziness episodes? After the episode ends, are there any after effects? How long after an episode do these after effects last? To what degree does your dizziness episodes interfere with your activities of daily living? Have you ever injured yourself in the course of an episode? What type of medication are you taking, and what is your response to that medication? Do you require more supervision at work than an unimpaired worker? Are there safety concerns of working at heights with power machines, operating a motor vehicle, or using other equipment? Do you have any mental problems associated with your dizziness? Do you have good days and bad days? And what do they look like? What would it cause you to be off task or take unscheduled breaks because of your episodes of dizziness? Are your impairments demonstrated by signs, clinical findings, and laboratory testing reasonably consistent with your symptoms and functional limitations? And what are those functional limitations that would affect your ability to work on a regular, sustained basis? And lastly, is there any additional testing that would help clarify the severity of your dizziness impairment or limitations? Now, I know that's a heck of a lot of information for your doctor to put in your medical records. The carrier's APS forms will generally not ask those kinds of questions, which is why I supplement them with a Social Security disability residual functional capacity form for dizziness or balance issues or Meniere's disease. I use that because I think it's a better way to supplement the APS form and to get your doctor to really address the relevant issues in a dizziness ERISA disability claim. If you suffer from dizziness and are applying for ERISA disability, I would suggest that you not go it alone, because disability carriers are going to be looking closely for the basis of the diagnosis, physical exam findings, functional, physical, and psychological restrictions and limitations in order to decide whether they're going to pay or deny an ERISA disability claim. And don't forget that they can terminate benefits if in your disability policy there is a subjective medical condition limitation. And then normally what will happen is that benefits will be limited to just 2 years because of that subjective medical condition limitation. And guess what? They think dizziness is a subjective medical condition. So you need to know that heading in. Got it? All right, let's take a break.